Welcome back to movementprofessional.com. So this is going to be the first video in a series I do on looking at pressure therapy. You can also think of this as self-massage or some type of foam rolling intervention. There's a lot of misinterpretations about what's going on when we self-massage or with massage in general. So I want to just put my spin on it, my understanding of it, my experience with it, and I want to break it down into a kind of a four-step process. And to make it a little easier to remember, we'll call it the 4 Ds of pressure therapy. So when you lay pressure on your body, or you lay your body onto any pressure, there's going to be an initial discomfort with that. And the intention of this pressure therapy work is not to seek out more pain, but it's often to desensitize to pain. So the first D would be to desensitize. So when you get onto any pressure, you want to make sure you are able to really recognize where's the onset of discomfort. And discomfort is obviously different for each person. So what I would say is just where do you find that there's a threatening stimulus? And you can usually get an indicator of that by your breathing mechanics. So if you start to hold your breath, if you can't allow your body to rest into that pressure and let go into that pressure, you're probably at your limit, and you want to be able to stay there until you can restore your breathing, or you can allow your body to get heavier into that pressure. So you have to find what's the onset of the pressure that we can tolerate. We don't want to just seek out more and more pain that's not helping anything. So we have to desensitize first. Once we can desensitize, then we can get into the second D, which would be to deepen. So we allow our body to get heavy, we allow the pressure to get deeper into us, and oftentimes that's what we're looking for. And once we deepen, then we can get into the third D, which is dissociation. So once we're able to get the pressure deeper into some structures, we can actually separate out movement of one joint from another joint that's surrounding it or right next to it. So that would be dissociation. And I'm going to go through specific examples of different joints that we can separate out based on using pressure as basically a block, a passive block for one joint so you can move another on it. And that helps with relative motion, because oftentimes we'll move two joints together always, and we don't really get much relative separation of one joint from another. And there we get a constant limitation of joint range of motion in specific joints because things aren't able to be separated. So it can be very valuable to get specific pressure to some areas and allow that pressure to deepen so that it can basically hold one area in place or give us an awareness or a proprioception of that area so that we can start to move around that area and actually start to restore specific joint range of motion. And then the fourth D I would say would incorporate all of them is that we want duration. We need enough time to allow all of these three things to happen. And then we often need enough time to allow our body to just relax and get an actual therapeutic effect from any type of pressure work. So again, there's a lot of discussion about pressure work or self-massage as improving mobility and actually improving the length of the muscle, and I'm not so convinced that actually takes place. But what we can get is a pretty quick neurophysiological effect that allows muscle guarding or muscle tension to let go. We can also get a neurophysiological effect where one intense pain might override another for a temporary amount of time, which certainly can happen. But if we want to look at getting the longest lasting benefit, there is quite a bit of benefit if we allow our body to just gradually over time get more tolerant to pressure. And we can think of this beyond any type of foam roller, we can think of this beyond any type of massage ball, but it's just, do we need to sit on a soft chair all the time, or can we sit on the hard ground? And how long can we tolerate sitting on the hard ground? It's not that we have to do it forever, it's not that we have to be afraid that if we sit on soft surfaces forever, we're going to get an inability to sit on harder surfaces, but we want to be aware of that relationship. So we don't want to feel like we always need support, and certainly the more support, the better. We need to feel like we have a variability of different surfaces and different pressures to our body. And in many ways, that pressure tolerance is the beginning of more movement tolerance. So if we can tolerate more pressure into the surface of our tissues, then oftentimes we'll be able to tolerate more ranges of motion, more speeds of motion, and again, we can start to separate out some motion from one joint to the other. All right, so this is just a little intro for the series that I'm going to do. And I'm going to go specific now into different areas of the body. We'll start with the abdomen, and we're going to try to dissociate out lower back extension from hip extension. All right, now we're on the ground here, and I got 3 different balls here. 2 of them are from Jill Miller's yogatune-up.com. She's basically the queen of self-care or this pressure therapy. She's got great products. She's also got great information about some of the benefits, and she really simplifies it in a way that can be very helpful for a movement professional like myself, but also for just a general client who just wants to get more out of their bodies. So I'm going to show you how to desensitize, basically going through 3 different pressures of balls. So Jill's ball, the Coregeous ball, is one of the best balls for just really starting the process of getting more tolerance to pressure in really any location in the body, but especially the abdomen. So this is just a ball that it's got a stickiness to it, which is nice because if you put it on the surface of your skin, you can move around. You can actually create like a little bit of movement on the layers of the skin and the underlying fascia. But it's also an air-filled ball, so you can choose how much air you want to put in it. So I usually take a little bit of air out because a lot of my clients, it's the first time that they're getting any pressure in their belly, and even a full ball with all the air in it is a little too much to tolerate. So this will be the first place we start, and then she also got this alpha ball here, which is about you can see the size of my hand here, and that's going to be something if we want to be a little bit more specific and off to the side, maybe getting into some of the deeper hip flexors like the iliacus and the psoas, we can use this, but this will be a little less intense and have a little less depth than this myo ball for power systems. So I tend to use these 3 balls depending on where people are in their desensitization process and how deep they want to get and how much dissociation we want to get from the lower back and the hip. All right, so there is a relationship to the 3 Ds that I mentioned earlier, where the more that you can desensitize, then the more pressure you can tolerate, the deeper you can go, then it's going to be easier to create more dissociation. However, if you're early in the process, you might be using a softer ball, and the softness of that ball is going to limit how deep you can go, really. But it'll be much easier to desensitize to this pressure first, but we might eventually have to graduate to a firmer ball or a bigger ball that goes a bit deeper and holds position a little bit better in one area so we can move around it from the other area and dissociate that joint motion. All right, but just to demonstrate from the start, we're going to go to the Coregeous ball right in the center of the belly too, because I find it's easier to just start in the midline, not have to confuse position as much, and just get people to breathe. So we're going to go initially on the belly, right on the belly button area, and starting on the forearms is actually a little easier than totally going prone. Because starting on the forearms, there's just a little less pressure here. If I go totally prone, that ball has to go deeper into my abdomen. So just to start the desensitization process, I'm going to just prop up on my forearms, and I'm going to breathe here. I'm going to inhale. The ball's going to move out of me. I'm going to exhale, let it move in. So if this is even too intense, moving side to side and just not letting anything sink in for too long, but just keeping the hips relaxed, keeping the belly relaxed, and just getting the body used to that pressure can be very valuable before you even breathe and allow the ball to sink in. So once that's more tolerated, then we can go down to a prone position and go through the same process. If you have to initially start with a little bit of a hip motion and just not keep it going too deep into the belly at first, that's fine. Eventually you breathe in, push the ball out, exhale, you let the ball sink in. So the longer you're able to exhale, the deeper the ball will be able to get. So this is a great way to teach the difference between a pressurized exhale that creates an abdominal bracing effect and a relaxed exhale, which would just be a complete recoiling of the diaphragm and no real effort of the abdomen. And just when you're in that state, the ball should just be able to go deeper, deeper, deeper. There won't be any guarding of the abdomen. All right, so with the ball in the middle, if we can get deep enough and we can start tolerating, we can start to dissociate either single-sided hip extension, which would be just to reach and hover
So now I'm not going to be able to reach very high, which is actually a good thing, because if I reach high, I'm most likely going to be tipping my body forward, and I'm going to be overextending my lower back. So I just want to feel like I'm reaching, and then I'll feel more pressure of the ball into the belly. So if I can't tolerate much pressure, lifting this leg is just going to make it worse. But if I can tolerate some pressure, I'll be able to tolerate this, and I can start to separate out one leg from the other without overarching the back. I can even start to try to go into a double leg lift and just feel my glutes engage without my back arching there.
All right, but you're not going to have as much blockage here of your lower back because the ball's a bit softer, and there's still going to be some give, so your back's still going to be extending there. Now, if I want to go to one side at a time, then I'm going to start to use the alpha ball first, and I'm just going to find the hip bone here and roll it up so I'm between my belly button and that hip bone. I'm going to put the ball there, and then I'm going to take on, still on the forearms, just to tolerate or to create a little less pressure in the abdomen, and then I'm going to go into this split prone position where one hip is out sort of like a frog, and I'm trying to keep this groin as close to the ground as I can, so I don't want to be tipped this way so you would be able to see my chest more. I want to be square to the ground, and I'm just going to see how I tolerate that. So it's the same process. First I might just roll around a little bit just to see if I can tolerate it. Then I want to let my body get heavy. I want to breathe into it. I want to exhale, let it sink in. Once I can tolerate that, then I go down. And I might even go arms overhead and fully extend out and just letting that ball sink in. Once I can tolerate the depth, it's desensitized, it's deeper, I reach. If I can do the reach of the leg, then I reach, knees hover, and I also add a knee bend, and then I bring it back down. And then I would do that for a certain duration. I like it like 90 seconds to 2 minutes of practice. You can do more. If you need more time to desensitize and deepen, take more time. All right, and then I would do that on both sides. And then the third progression, basically doing the same thing with the bigger ball. And what you can find here is right off the bat, that's more sensitive, so I have to let my body relax a little bit more. I'm going to spend time on my forearms, and then I'm going to work myself down. And here, there's quite a bit more pressure when I go to lift the leg, but I also can get a better idea of the separation of my hip from my lower back. Because my lower back's, it's going to be very hard for it to overextend here with the pressure in the ball. So I'll go through that practice. Eventually, if you do this long enough, you just know, okay, I'm going to go maybe for the bigger ball, or I'm not ready for the bigger ball. You'll just do your session with whatever you feel you're ready for. But just understand that there is a progression, just like weight training. There's a progression that you would go through with any of your self-care work. All right, and it's not more pain is better. That is not the idea of it. It is really about creating depth so that you can understand your anatomy a little bit better and then move around that pressure or that passive block. If you have any questions, comment below, or you can go to movementprofessional.com. I'll see you next time.